right, today we're going to break down a really important study that answers a question many of us in GI have been asking. Just how safe is colorectal ESD for our oldest patients? Let's get right into the data.
With people living longer all over the world, this isn't just an academic question. It's something we're facing in our clinics every day. We need solid data to help guide these tough decisions. And thankfully, this huge study out of Japan gives us exactly that.
So first, let's just quickly set the scene. We all know colorectal cancer is a huge deal, and as our patient population gets older, finding the right treatment for them becomes absolutely critical. And one of our best tools, of course, is endoscopic submucosal dissection, or ESD. It's fantastic because it lets us take out these large, early-stage tumors all in one piece, that en-bloc resection we're always aiming for. It's way better than piecemeal removal. But let's be honest, it's a more complex procedure, and it comes with higher risks of things like bleeding and perforation, especially when you're dealing with more fragile patients.
Okay, so before this big new study came along, what did we actually think we knew about the risks of ESD in the elderly? What was the evidence telling us?
Well, for patients under the age of 85, the picture was pretty reassuring. Most of the studies we had suggested that, the risk of bad outcomes didn't really go up with age. But the moment you looked at anyone over 85, there was this massive blind spot in the data.
And this quote really just hits the nail on the head. The handful of studies that even looked at the 85 and over crowd were just, they were tiny. They were too small to tell us anything for sure. It left clinicians like us in this sort of data-free zone, basically having to guess when treating our most vulnerable patients.
And that's where this new study just completely changes the game. Researchers in Japan decided to fill that gap by tapping into a massive nationwide database, and that gave them the kind of statistical power we've only dreamed of. Get this, they analyzed almost 144,000 cases of colorectal ESD over about a decade. Just think about that number for a second. It's huge. But here, this is the number that really matters. Of that massive total, they had nearly 8,300 cases in patients who are 85 or older. Finally, a sample size big enough to give us some real, reliable answers about the risks in this specific group. So, the million-dollar question, what did all this powerful new data actually show us? Well, the main finding is crystal clear. Once a patient hits 85, the risk of something going wrong starts to climb. I mean, just look at this chart. You can see the story with your own eyes. The overall rate of adverse events goes from about 5% in the 60 to 64 group, and it jumps to nearly 8% for those 85 to 89. And then for folks over 90, it's over 9%. That's a trend you just can't ignore.
And the hard stats really nailed this down. After they adjusted for all the other factors, the odds of an adverse event were about 20% higher for the 85 to 89 group. For patients 90 and up, the odds were a whopping 45% higher compared to the younger group.
So the next logical question is, why? What's actually driving this increased risk? Is it just that the procedure itself is technically harder in these older patients? Well, the data suggests that's actually not the case. And this is where it gets really, really interesting. The study found that the risk of things like a perforation during the procedure or the patient needing surgery later, those risks didn't really go up with age. So it's not about the technical skill or the difficulty of the dissection itself. Something else is going on. So what is it? This chart basically screams the answer at you. When you look at what went wrong in patients 85 and older, one thing stands out by a mile. It was postoperative bleeding. That was the main culprit, driving the risk way up. And let's be very clear about what they mean by bleeding here. We're not talking about a little bit of oozing. This was defined as serious, clinically significant bleeding that happened within 30 days of the ESD, even after they went home. It was bad enough that they either had to come back for another scope to stop the bleeding or they needed a blood transfusion. So the researchers dug even deeper, and they found a couple of major red flags in this age group. The first, no big surprise, was being on anticoagulants, especially DOACs and heparin. The second one, which is pretty interesting, was severe obesity, so a BMI of 30 or more. Okay, so we have all this fantastic new data. Now what? What do we actually do with it? How should this change what we do in our day-to-day practice, no matter where in the world we are?
Well, this slide is maybe the most important one of all, because it's all about perspective. Yes, the risk for ESD goes up after 85 to about 8 or 9%, but you have to compare that to the alternative, which is surgery. For these exact same patients, the reported complication rate for surgery is anywhere from 29% to over 66%. So even with the increased risk, ESD is still a much, much safer option. So it all kind of boils down to a pretty clear, practical thought process for us. Step 1, we have to acknowledge this increased risk. It's real, it's proven. Step 2, we need to be extra careful about identifying the highest risk patients, the ones on anticoagulants or with a high BMI. And step 3, all this information just makes us better equipped to have those really important individualized conversations about risks and benefits with our patients. In the end, the message from this landmark study isn't stop doing ESD in the very elderly. Not at all. The real message is that now we have the data we need to make smarter, safer, more informed choices. And that leaves us with that final, crucial question we all have to answer. How do we take this knowledge and use it most effectively in our conversations at the bedside?